Indian delegation representing 47 pharmaceutical companies were in Ethiopia attending Ethio-Medical Exhibition that opens today with a view to exploring business opportunities in Ethiopia. Delegation head Deepti Pant told journalists today that the companies represent businesses in the health sector, ranging from medical devices, lab equipment, to manufacturing. Hospital and telemedicine companies are also included.
We have this group of around 50 Indian companies from various sectors in the healthcare industry, from medical devices, medical equipment, surgical equipment, lab devices, and hospital infrastructure, hospital development techniques, and other telemedicines and other know-how that Indian companies have in the healthcare sector. And we would like to invite all the Ethiopian importers associations and procurement bodies to meet them from 3rd to 5th March in the Skylight Hotel, wherein Indian businesses are waiting to meet you, and look forward to all possible joint ventures and all possible business opportunities that can happen.
The visit will give members of the delegation a chance to explore the Ethiopian market, the head added. According to her, the delegates will take part in Ethio-Medical Exhibition that opens today with a view to exploring business opportunities in Ethiopia and looking for possible joint ventures and create connections among various stakeholders. The delegation head invited Ethiopian investors who are looking for joint ventures, medical association members, procurement bodies, and importers to take advantage of the exhibition. India's ambassador to Ethiopia, Robert Shenkintong, said the bilateral trade between the two countries has reached over $1.1 billion.
The presence of Indian investors here in Ethiopia is substantial. According to the Ethiopian Investment Commission, 650 Indian companies have registered with EIC. We estimate that about 400 of these Indian companies are active on the ground. If we look at our bilateral trade, almost about 20%, or let us say, 20% of the bilateral trade basket is for the pharmaceutical sector. So that is why, and there is tremendous scope to further improve these sectors.
According to him, some 20% of the bilateral trade is in the pharmaceutical sector. The ambassador, who noted that there are 2 Indian pharmaceutical companies working in Ethiopia in a joint venture, added that some companies are on the way. Soon there will also be an Indian hospital in Ethiopia, which he said will be inaugurated soon. Ambassador Shenkintong further pointed out that over 400 Indian companies are active in Ethiopia. Briefing the delegation members about business opportunities in Ethiopia, Cadila Pharmaceuticals Ethiopia plc General Manager Kanchan Banerjee said there is a big opportunity in Ethiopia for the pharmaceutical sector.
Well, in Ethiopia, business opportunity is huge because local production is very less. So 85 to 90% medicines are imported. So to produce locally has got enormous opportunity. So there is no problem for that.
The estimation of the pharmaceutical market in Ethiopia is over $500 million, and Ethiopia has been importing 85 to 90% of medical-related stuff, ranging from medical equipment to medicines, he stated.
When we came, we did not expect even that much, more production, Then after that, we saw that we can increase more and more products, and there are a lot of opportunities to sell here. So because people prefer medicines to buy from local market due to foreign currency shortage, etc. So plus Indian medicines, people, doctors, and everybody respects, the quality of Indian medicines, and also the cost benefit of it. Because common Ethiopian people can afford Indian medicine.
With a market of over 110 million people and the availability of a skilled and semi-skilled workforce as well as various government incentives, the industry offers a big opportunity for Indian pharmaceutical companies, Banerjee elaborated. He noted that among the incentives that the government of Ethiopia offers to investors are 4 to 10-year tax holiday and import of duty-free raw materials, including packaging. Less duty to COMESA countries and duty-free export of medicines to neighboring Sudan are also among the incentives that investors benefit from. Moreover, the general manager stated that the availability of up to 50% bank loans, with 11 to 15% interest by the local banks to pharmaceutical companies, coupled with other incentives for plants and pharmaceutical parks, make Ethiopia a good place to invest in the sector.